Hey guys, it's Erica with Rice Med Spa. We have Danielle here today. It's okay, you're going to learn too, so you can watch as we go. And so she's here to get cheek filler. She's had cheek filler once before with me about a year ago. She had 2 syringes actually on each side, and it's lasted a long time. Actually, she only needs 1 syringe on each side this time around. We use Restylane Lyft because it's a nice thick product. And it doesn't have a lot of flexibility, and we don't want that for this area. We want it to remain right where we put it, so it creates that lift, and the lift lasts for her for a while. So first we're going to talk a little bit about some of the arteries in the face. It's very important to know your anatomy and the arteries as you're injecting filler. So the first important artery to be conscientious about is the facial artery. And you can find that by asking the client to clench down like you're biting really hard, chewing. And you can feel for the masseter muscle. Her masseter muscle is probably, so about 2 centimeters anteriorly from the masseter muscle, you can palpate an actual notch. Can you feel your notch? Yeah. Right here. It's right on the bone of the jawline. You feel that notch? Mm-hmm. So that's where the facial artery comes up. And when it comes up, it's pretty superficial. So when we treat the jawline, it's important to stay down on boned periosteum here too. So everybody's different, but usually this kind of runs up like this, and it branches off here and here. And this is what provides circulation to the lips and the area around the lips. This is known as the superior and inferior labial arteries. However, some people are different. So when you're filling lips, you have to be very conscious about palpating and looking, because sometimes you can actually see the artery here kind of palpating. So with that said, you want to remain pretty superficial in this area, but you really want to be looking out for that because everyone's anatomy is a little bit different. Then it kind of travels up. I don't want to get into your numbing cream here. Comes up to the nose, and it kind of then branches up a little bit and creates these little anastomotic branches that feed the nose. This here is called the lateral nasal artery, and then as it runs vertically along the lateral sides of the nose, it becomes known as the angular artery. Now this here, to treat the nose area, some people call it like a non-surgical rhinoplasty. You'll see people doing this, and pretty much if you stay right down on bone to the center of the nose with filler, it's a more safer area. However, you just really never know one's anatomy. And so sometimes these anastomotic branches come across, and you never really know that. And this is considered one of the highest risk area to put filler, because this angular artery comes up and feeds the back of the eye. So there has been reported cases of blindness. Yeah. So then as this angular artery comes back from the back of the eye, it comes out here and here. So this is known as the supratrochlear artery and the supraorbital artery. And then these have little anastomotic arteries here that feed the forehead. Forehead is another high region here that creates a lot of problems for clients, emergency-like issues, because it doesn't have a very high supply of circulation. It relies pretty much solely on these little anastomotic vessels. So typically if you occlude one of these, the outcome is not going to be good. Yeah. So I will resume cleaning Danielle's face, and then we will continue with the video when we're ready to start her cheek process. Alright, so we cleaned Danielle's skin with witch hazel, and we prepped it with our combination. topical ointment. It's BLT, benzocaine, tetracaine, and lidocaine. So she's pretty numb now. I use a micro cannula for this procedure. 2 reasons. The first reason is because I only really need to make 2 puncture sites for an area this big. If I were to use a needle, I would have to make multiple sites. So it's less puncture sites for the client and more comfortable. And also it has a blunt tip at the end, so rather than it protruding into a vessel, it pushes the vessel out of the way, so it minimizes bruising. As we're going to introduce the needle, little stick. And you can tell that Danielle's so scared. She's watching herself in the mirror here. And I kind of go like a little bit kind of side to side to really make that opening for my cannula.
It's very comfortable. I don't have any pain.
Thank God. You're pretty numb. Cheeks are pretty comfortable. If anything, you may feel a little bit of pressure.
Correct. No pain.
I always like to just push to see my entry point and make sure your bevel's pointed up. And just kind of wiggle.
Yeah, it's a little ouchy.
I know, it's kind of weird when you watch it yourself, I think. And just slowly kind of introduce it until I get to where I want to be. And I want to be right on that periosteum. And then if I lift a little bit, I can see where the tip is, and it's where I want it to be. How comfortable are you, Danielle?
Oh, very comfortable. No pain.
No? 0?
0.
Awesome. And then for safety, we always check for a blood return. Good. And then we're going to start filling a little bit here. And I like to do a little bit of a retrograde. So I am filling as I retract. All right, so this is my second puncture site here. I'm introducing the needle. Go a little bit back and forth. And I use a 25 gauge cannula. Any smaller than that actually acts just as a needle would. So any smaller than this doesn't seem to be just as safe to me as the cannula. How's that feel?
Fine. No pain.
Cool.
A little off from the hole.
There we go.
There you go.
So you got it.
Yeah.
All right.
Yeah, just let it go.
That's all. Hey, no one's perfect. So actually what's nice too is you don't want to be in the tear trough area with this filler, but you can be below it, and it helps to minimize the shadowing. So it's kind of 2 different benefits, which is really nice.
That would be mean, minimize the shadowing.
You know, your under eye shadowing here.
Oh. Dark circles.
Yeah. You feel anything here?
No.
On a scale from 0 to 10?
0.
Sweet. It's good that, Julie, you're good with this stuff.
Yeah. It felt
I do all day is just watch videos of this stuff.
Of this stuff?
Well, it's looped in with my lash stuff and eyebrows. It's general.
So you're familiar.
That's super cool.
Okay, and then I'm gonna come and go up this way. Sometimes
Oh, I'm
it's-
so
no,
sorry.
you're
I'm so
fine.
close.
No,
I'm
you're
really
good.
watching.
You're good. Sometimes this could be a little tricky.
Getting it back in the hole, right?
Yeah. There you go.
So now are you almost like screwing it in?
I'm kind of breaking through the tissues.
Okay.
So sometimes you feel a little bit of resistance as you go. And rather than just push through, I twist a little bit. Sometimes I'll push a little bit of filler as I advance. Now, when you do cheeks, they say this is the sweet spot. So that should almost be sort of like your high point for women.
Looks great.
Yeah, that's pretty. I'm jealous. I need mine done.
Yeah.
Definitely.
It's funny when you're in there twisting and stuff. I truly don't
You
feel
don't
it.
even feel it. It's
I
great.
don't feel it.
Yeah, that's why I really like the cannula for this area.
So you are aspirating and injecting at each point of stop.
Pretty much. I mean, not every single spot because I'm pretty much in the same. I'm just changing the tissue plane, if that makes sense.
Mm-hmm.
Below this zygomatic bone is the transverse artery,
Right. Mm-hmm.
and that is a more. It's actually a more deeper artery.
Oh.
So below the zygomatic, you want to, if you're going to inject down there with filler,
Mm-hmm.
you want to stay more superficial.
Gotcha.
Side, we cleansed her face again. I'm always a fan of cleaning. And then we're going to introduce the needle, little poke here. I like to go a little bit back and forth here, side to side. And you don't have to go really deep when you introduce the needle. I like to use the gauze just to kind of keep the hair back too. And this product too has lidocaine in it. So as we inject, you become a little bit more numb also from the inside as well as the exterior from the topical. So again, just nice even linear threads as I retract. How's that feel?
Good.
This is one of my favorite products for sure. And I always tell everybody, like, I'm a big fan of prophylactically doing these things because, for one, it's cheaper. and sometimes it's just really hard then to get that lift once it's gone.
Mm-hmm.
It just looks like it really gives like good definition to the
Sure.
cheekbone.
Mm-hmm. Mm-hmm.
And it'll also help. A lot of times clients come in and they want the marionette lines and the nasolabial folds treated. And I don't really do that. I don't really go there first. My first step then is to start up here with the cheek area because we have what's called a little malar pad in this region, and from gravity and as we age, this malar pad actually shifts downward, and when it shifts downward with gravity, it really exaggerates these folds here. So I find that a lot of times if clinicians will go straight to fill that area without filling the cheekbone, it tends to have an unnatural look to it. So I much rather start here, and then if the client feels like they want a little bit yet down there, then I will fill in a little bit down there. There we are. All right, so our second entry point here, little poke. And if you notice those beautiful lashes, Julie had just provided her with a beautiful lift and tint. And how long does that last? I forget.
The lift lasts for a while. It should last probably maybe 10 weeks, 11 weeks.
Awesome, yeah.
And the tint should last about 4 weeks.
And that's definitely a nice alternative for people who just aren't ready to commit to lash extensions. How's that feel?
Good.
And again, this is,
Comfortable.
could be kind of the sensitive area because this is where that nerve comes and enters the facial area. Other angle as I did earlier. I'm gonna switch spots.
I'm gonna turn my head.
Yeah, a little bit. And again, we're just coming in here and a little bit more definition where that sweet spot is. And I'm hitting some tissue. So just advance easily here. Perfect. How's that feel, okay?
Yep, no pain.
Sorry about that.
Oh gosh, that's all right. Nice.